Eosinophilic lung disease is a rare entity and requires strong clinical history to mention as a single diagnosis or on top of differential diagnosis. Otherwise, it will be included in the list, but not as a priority. Here we have a patient having symptoms of cough and shortness of breathing more than 3 months. Chronic eosinophilic pneumonia needs symptoms more than 1 month. So this applies well to the chronic eosinophilic pneumonia. Also, the presence of blood eosinophilia, which is, in my opinion, is the strongest mark to suggest the eosinophilic lung disease. Bronchoalveolar valve as well, elevated eosinophilic count will make the diagnosis of eosinophilic lung disease is most likely. Here we have patchy opacities in the upper lung zones and lower lung zones. Let's go to the HRCT, which of eosinophilic lung disease we can suspect here. We have ground glass opacities in the upper lobes and consolidation, peripheral location, and bronchocentric. You can describe it as geographic as well. And extending to lower lobes, but in less extent and amount. So we have upper lobar predominant. This is the picture of chronic eosinophilic pneumonia. Additional characteristic feature is presence of atelectatic bands of consolidation, as you can see here. The orientation of this is parallel to the diaphragmatic pleura. Let's see it on chronic reformat. Here we can see the band parallel to the diaphragmatic pleura, and upper lobar predominant of the findings is nicely shown here, that the abnormality of ground glass consolidation, bronchocentric and peripheral in location is more in upper lobes than lower lobes, which is opposite to the distribution of the differential diagnosis of this case, organizing pneumonia. According to distribution and predominance of the findings of GGO and consolidation, atelectatic or consolidation band-like appearance as well, in presence of eosinophilia and chronic setting, will be strongly with the diagnosis of chronic eosinophilic pneumonia. This patient has dramatic improvement on corticosteroid therapy, improved within 6 days. As you see here, almost complete recovery of the lower zonal patchy opacities noticed before, with residual upper lobar or upper zonal opacities less in extent. Thanks for your attention.